Hello friends, today we are going to discuss one important methods and very simple methods for the screening of drugs which are acting on respiratory activity, and under that the method is bronchial hyperreactivity. Now first let's see how what is the principle of this test. So bronchial asthma, there is a narrowing of the bronchial smooth muscle, and because of which there is a difficulty in the breathing. So it is totally related to the airway obstruction. Now, in this case, in this bronchial hyperreactivity test, we have to observe the asphyctic convulsion which are resembling the bronchial asthma in patient, and that can be induced by or challenged by the spasmogens like histamine, which produces the bronchospasm in the guinea pig. So when you challenge the animals with this spasmogen, it shows first symptoms as the increased breathing frequency. So one has to observe the increased breathing frequency. Then after there is a forced inspiration is observed, and finally you will observe the asphyctic convulsion which is observed in the patient of bronchial asthma. What is this? So asphyctic or asphyxiation, it is a condition of deficient supply of oxygen to the body which arises from abnormal breathing. So in animal, one has to observe the asphyctic convulsion, the appearance of asphyctic condition. So, how this experiment is carried out, just see. So, in this case, you need to have a box which is divided into three parts, part A, B, and C. So, in as this box will be transparent so that you can observe the activity or note down the responses in the animal. This box containing the sluice. Sluice is nothing but the gate from which you can move from box A to box C via box B. Now, both the three boxes, they are properly ventilated with an airflow of 1.5 liter per minute. So, all the three boxes are ventilated with this airflow that is given. Then you can use a guinea pig for this experiment. The guinea pig, male guinea pig with the weight of 300 to 400 gram should be chosen. Then the box A is connected with the nebulizer, and a specific type of ultrasound nebulizer is attached here, and this nebulizer is LKB NB108, which produces the aerosol of 0.2 ml solution of test drug in 1 minute. So if you have the test drug or a standard drug or an unknown drug, you can uh, insert that drug in the chamber A via the nebulizer so that animal will be exposed to your test drug initially. Or other thing is that if you want to inject the drug, you can inject by infusion pump, or orally or subcutaneously you can administer the drug to the animals. After that, the uh, uh, C part of the box, it also containing the facility of induction of the drug, and here also the nebulizer is attached. So guinea pig, uh, after exposure to this test or standard drug, the guinea pig is allowed to enter into the box C. When it enter into the box C, then the guinea pig is exposed or challenged with the spasmogen like 0.1% solution of the histamine hydrochloride. Then you have to observe the development of asphyctic convulsion. Once the asphyctic convulsion start developing, then stop the experiments and remove the animal from the gauge. So in this case, the evaluation is what? The first is the percent increase pre-convulsion time is calculated versus control. So first you take the response of the control with and without test drug, and second you have to give the test drug and take the responses. So the time which are changes, the time changes in the development of the pre-convulsion, it's calculated, and from that ED50 value can be found out. So if you like this type of video, so kindly subscribe, like, share and comments this channel. Thank you once again for your patience listening.